As you know, many people depend on prescription or over-the-counter drugs to cope with heartburn every single day. But a new study shows one class of those drugs may increase your risk of death over time. Dr. Kevin Campbell joins us now to talk about this new study published in the journal BMJ Open. So let's talk about this. Proton pump inhibitors. That's what we're talking about, right?
Exactly. We call them PPIs, or proton pump inhibitors. They work in the stomach to decrease the amount of acid that your stomach produces in order to help you kind of decrease the symptoms related to heartburn and reflux. Common names are Prilosec, Nexium, Prevacid, and they're sold over the counter or by prescription. Other acid-blocking drugs that are available are called H2 blockers, and these are things like Zantac and Pepcid. They work on blocking acid production in a very different way from PPIs.
All right, so what did the study actually show?
You know, researchers from Washington University School of Medicine in St. Louis looked at almost 300,000 people who had been given either a PPI and then about 75,000 people who had been given an H2 blocker. And what they found is they compared the rate of death in these two groups, and they found an increase of 25% increased risk of death in the patients who took PPIs compared to the ones who took H2 blockers. To put that in perspective, that's about one extra death for every 500 people taking PPIs in a year. In addition, they found that the longer you were on this PPI drug, the greater your risk of death.
All right, so I suffer from indigestion every day. I certainly have to take something. What do you do if you're on a PPI at this point?
You know, first of all, as with all the studies we tend to report here on CBS, this was an observational trial. It didn't prove cause and effect. So it does show a strong association, so we need to study this more. It doesn't mean that you necessarily should stop taking these drugs. You got to talk with your doctor and determine if the benefit that the drug is providing outweighs any of these risks that we're talking about. For many, PPIs are a great way to treat bleeding, ulcers, and other problems, and you may need to be on them long term. However, with any medication, it's important to reevaluate your need for a particular treatment every single time you talk to your doctor. So, you know, bond with your doctor, understand why you're on it, and go from there.
And don't be afraid to ask for a second opinion.
Absolutely. Second opinions are fantastic, and we've done a study here that showed that second opinions actually save lives.
That's a good thing to hear. We like that. All right, thanks, Dr. Campbell.